Assalamualaikum warahmatullahi wabarakatuh. My name is Mustika, Cintya, Wafi. I would like to continue about all these explanations of types of language disorders. And then there is stuttering. Stuttering is a speech disorder in which sounds, syllables, or words are repeated or extended, interrupting the normal flow of speech. So a person who have stutter, she or he know what they want to say, but they difficult to saying it. For example, they always repeated or prolong the words. Is it like for example how to say types? They say like the types, the types, and these speech disorders may accompanied by behaviors such as rapid eye blinking or trembling lips. Stuttering can make it difficult to communicate with other people. Like what I example just now, someone who have stuttering disorders, when they talk, they have, when they talk, it can accompanied by behavior such as rapid eye blinking or trembling lips. Jadi seseorang yang punya gangguan gagap itu kalau ngomong itu mereka sering mengedipkan mata dan bibirnya bergetar seperti itu. And then there is causes of stuttering. The first is abnormalities in speech motor control. Some evidence indicates that abnormalities in speech motor control, such as timing, sensory, and motor coordinator, are implicated. And the second is genetics. Stuttering tends to run in families. It appears that stuttering can result from inherited genetic abnormalities in the language center of the brain. Jadi gegap juga bisa berasal dari keturunan. And then medical conditions. Stuttering can sometimes result from a stroke, trauma, or other brain injury. And the fourth is mental health problem. So, in rare isolated cases, emotional trauma can cause stuttering. And the next explanations of types of language disorders, there is Down syndrome. Down syndrome is a genetic abnormality. This syndrome occurs because of an extra copy of chromosomes. So, Down syndrome is a genetic disorder that causes sufferers to have a low level of intelligence and characteristic physical disorders. It is typically associated with physical growth delays, characteristic facial features, and mild to moderate intellectual disability. Seperti kita mungkin kita pernah menjumpai kalau penderita Down syndrome biasanya memiliki bentuk wajah yang hampir sama. Itu karakteristiknya yang saya ketahui. And then Down syndrome causes lifelong developmental delays that can range from moderate to severe. It cannot be cured, but there are options. Options in these discussions, it means about Down syndrome treatment. There are physiotherapy, talk therapy, occupational therapy, and behavioral therapy. And then types of Down syndrome, there is trisomy 21, mosaicism, and translocation. The first is trisomy 21. Trisomy 21 means there is an extra copy of chromosome 21 in every cell. This is the most common form of Down syndrome. And then the second means mosaicism. Mosaicism means there is an extra chromosome in some but not all of child cell. Individuals with mosaic Down syndrome tend to have fewer symptoms. And then the third is translocations. There is rearranged chromosome material. In this case, there are to 21 chromosome, just like there are in trisomy 21, but one of the 21 chromosomes is attached to another chromosome instead of being separate. Jadi seperti ini. Di translocation ini, kromosom 21 itu kan ada 2 kromosom nih. Nah, kemudian one of 21 chromosome is in trisomy 21, but the other yang ini tuh nempel di kromosom yang lain. Jadi tuh mereka itu nggak bareng, kepisah gitu. The next types of language disorder is autism. Autism is a neurodevelopmental disorder characterized by impaired social interactions. Characteristics that stand out in someone with this disorder are difficulties in building social relationships, and communicating normally and understanding the emotions and feelings of others. And then the diagnostic criteria require that symptoms become apparent before a child is 3 years old. So, the symptoms of autism, it can seen before a child is 3 years old. So early detection and therapy will make the sufferer more able to adjust to normal, something like that. And the last types of language disorder is ADHD, attention deficit hyperactivity disorders. It's one of the most common childhood disorders and can continue through adolescence and adulthood. ADHD is a condition of the brain that affects a person's ability to pay attention. So, ADHD is a mental disorder that causes a child to have difficulty focusing and has impulsive and hyperactive behavior. So, the sufferers cannot stay calm down and always want to get in movement. ADHD symptoms generally appear in children before the age of 12. However, in many cases, the symptoms of ADHD can be seen since the child is 3 years old. ADHD that occurs in children can carry over into adulthood. And the next, there are the symptoms of ADHD on children. The first is symptoms of inattentions, the second symptoms of hyperactivity, and the third is symptoms of impulsivity. And for the first symptoms of inattentions, it is similar to the other presentations of ADHD, except that is characteristic primarily by problems with inattentions or a deficit of sustained attention, such as procrastinations, hesitations, and forgetfulness. And the second symptoms of hyperactivity, children who have symptoms of hyperactivity, they may fidget and squirm in their seats, talk non-stop, dash around, touching or playing with anything and everything in sight, and be constantly in motions. And then the third symptoms of impulsivity, they may be very impatient, blurt out inappropriate comments, show their emotions without restraint, and act without regard for consequences, have difficulty waiting for things they want or waiting their turns of games. And for the last, in most cases, the cause of ADHD is unknown. The most likely cause of ADHD appear to be genetic. So, many children with ADHD have have a family history of the disorders of behaviors associated with ADHD. So that's all from me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.